Okay, thank you. Good morning, everybody, and welcome to our session on the economics of COVID-19. I'm going to share my screen. I have some colleagues that have joined me for this session. And let me just get the slideshow going from beginning. Let's see here. There we go. Really a pleasure to have an opportunity to share information on two big words for 2020, economics and health. And I think if you look over the year, those two words have trended more than any two. And I think that most people today will be able to tell you that the two have a lot to do with each other. When health isn't good, the economy is not strong. And when the economy is not strong, health isn't good. And these have been things that have been debated throughout the year. I have with me three colleagues that I've gotten to know through the presentation, and they are Dr. Tom Cunningham. He's an economist, and he's the chief economist with the Greater Atlanta Chamber. Tom also has a background from the Federal Reserve Bank, and he's been a real leading voice in regional economics, not just in Georgia, but throughout his whole career. And I was telling Tom that he needs to repackage himself now as an economic designer, because economics has become such a cool thing now in the COVID era. I have also my friend and colleague, Dr. Barbara Terry. She is a Trip Umbach senior consultant, but she's got an illustrious career, 50 years of healthcare leadership. Barbara's also been a CEO at a community hospital. She's been an executive at a large health system. She was the president and CEO for the Institute of Healthy Communities. Barbara and I have had a 30-year relationship working mostly in Pennsylvania, but also throughout the United States in the community health and community improvement space. We have Kirsten Axelson. Kirsten's from New York City, but she's hiding out during COVID in the Adirondacks. She's an independent consultant. She's a health policy expert and leader. She's with the Aspen Institute with Charles Rivers Associate. And her slides you're going to see are very pertinent to the discussion up until the minute on what happens with COVID vaccines and what opportunities there are and how that affects the economy. Sorry, my voice is a little bit off today. And I'm Paul Umbach. I'm the founder of a company called Trip Umbach, and we are based in Pittsburgh, Pennsylvania. We've had a chance over the years to work in 500 communities in all 50 states, and have done a lot of work in Georgia over the past 25 years, both in South Georgia, Metro. We've worked with different groups throughout the state, medical schools, health systems, and universities. And so I live at the intersection of economic development and healthcare, and that's, I think, very pertinent for today. We're going to begin with Dr. Tom taking us through some high-level economic perspective, because I think as we think about COVID, we have to start getting an idea of what it really meant from an economic perspective as much as a health perspective. So Tom, we're going to go to you. I do have this slide here. This is my preview slide, which is that COVID was really the Pearl Harbor moment. And like Pearl Harbor, we realized that we really weren't prepared. And it's not so much what happens up to Pearl Harbor, and we're all very involved still in the Pearl Harbor moment. It's become a longer moment than maybe the Surgeon General in this quote said it would be. It's been more like a year, or as my millennial friends say, oh, you've been there for a moment or a minute. And I always say that's like 30 seconds, but my millennial friends tell me that a moment or a minute can be a long time. And I think we're in a millennial minute right now, like it could be a couple years. But really this event is going to be measured in our lives, much like 9/11. It's going to be measured in our lives like my dad, who was in World War II, he will remember when he was alive, this Pearl Harbor moment. So these are moments in time that are important. So I'm going to turn it to Tom, and he's going to kind of take us from there.
Okay,
Tom, you're up.
thank you, Paul. And let me just say I'm kind of startled to hear that economics is now a fashionable thing because of COVID. That I think has just shown how much COVID has lowered our standards for entertainment. You know, I don't know what to say. Um, in general, I don't have slides. That the slide that's up here now, I'll refer to in a few minutes. But the problem with doing economics and PowerPoint, particularly macroeconomics, is that the data gets stale really quickly.
Yeah.
And the point I want to make here, I want to talk about kind of what COVID did to the economy in some sense. But I also want to make the point here that in terms of economics, we're in a very different situation than we have been in the past. As Paul said, I spent my life, the majority of my adult life at the Federal Reserve. So thinking about this from a policymaker's viewpoint, the problem this time around in terms of the economic impact is unlike one that we've experienced before in our lifetimes. That in general, the problem with recessions is that you know, you got a slowdown in the economy, people are reticent to spend, and the problem is you got to get them back into the office buildings and into the restaurants and into the stores. That wasn't the problem here at all. That this is kind of the opposite side, that in mid-March, even though people had the means and the motive to go out and spend and, you know, engage in commerce and do all the things they normally did, COVID shut that down. And so the consequence of this is sort of the inverse of what we typically see in a recession. Until we get the pandemic actually under control, it doesn't need to be solved. We just need to see the light at the end of the tunnel. From a policy perspective, we're kind of stuck in the sense that, you know, once you know that this stuff is going to be over, then the standard policy tools to get people back employed with stimulus and you know, spending ideas and employment ideas, we're pretty good at that. And I think we'll be able to manage this fine. But until you actually know when those policies are appropriate to be put in place, you're kind of in trouble, that you're stuck with a lot of sort of bridge loan stuff. And the problem with bridge loans during a crisis is that you really should know how long the bridge needs to be, and we don't. And that's a huge problem. So conceptually, this recession, the economic impact here is very different than anything we've seen in the past. But physically, it's also really different too. And so I've got two slides that illustrate this, and these are my favorite slides. This one sets up the next. Every month, first Friday of the month, and this will happen this Friday, tomorrow, the US Bureau of Labor Statistics releases the employment survey, the jobs report. And every month we get, you know, prior to COVID, a couple 100,000 jobs created. Here, what you see is the history of the US labor market for the last 30 years. On a monthly basis, the shaded areas are recessions. You know, what you see is that during the Great Recession, which again, recall was the worst recession we've had since the Great Depression, we had about 800,000 jobs lost on a monthly basis. That was just horrible. And then during recovery, we got a little over 500,000 jobs coming forward. Okay, so now look carefully at this picture, and Paul, if you would scroll to the next slide. This is exactly the same picture that you just saw, but with the COVID data added. And what you see here is something amazing, that basically what has happened over the last 30 years is trivial. Even the Great Recession that you see in the shaded area there, it does get off the flat line a little, but you know, come on. the fact is that in terms of the disruption in the labor market, we've just never seen anything like this, and we're not going to see anything like this again. In April, we had over 20 million jobs lost. That was kind of an overshoot, and the US employment labor market is quite resilient. So we came back with about 5 million jobs created the month after that. The churn in the labor market was just incredible. And again, the idea that you can draw implications from previous recoveries based on what you're seeing this time around, no. You know, there probably are some parallels to be sure, but in general, again, that little blip around 2008 down was the worst recession that we've had since the Great Depression. This is just almost, as Paul said, biblical in nature. We're in a very different situation. Now, there are a few things that come out of this that I think are useful to mention, and then I'll turn it over. The first is that one of the big things that happened in economic terms is that a lot of stuff that we knew was going to be happening anyway has been pulled forward. So a lot of stuff like online shopping, a lot of stuff like remote working, you know, things we all wanted to be able, you know, if you were in an office and you could work from a beach, that was what you aspired to do. Well, now you can. And that was an investment that we all knew was kind of going to happen over a period of time, but it was forced in the early part of this year. Another thing that happened on the downside is that things like small retailers that we knew were kind of endangered anyway are really in trouble now. And even some not so small retailers that if you don't have a serious online presence and you're in kind of consumer retail goods, you've got a problem. On the other hand, things like logistics, both for consumer goods and for you know, all kinds of goods in GDP are booming right now. Warehouse space is in huge demand. Logistics techs are in huge demand. So all the stuff that we kind of knew was coming has come here in a very accelerated way. The final thing I'll say that I'll leave you with that is kind of problematic and very unfortunate is that we're having real problems with income distribution. Yeah. You know, we've always had kind of issues with income distribution, but going into this recession, we had historically tight labor markets. And the beautiful thing about tight labor markets is that it increases the demand for workers. And what we were seeing was wage increases in the lowest quintile of income earners, though their wages were going up in percentage terms faster than anybody else's. Now, part of that, of course, was just because we started from a low base. But the fact is that we were seeing a compression of wages across the board, with the low end being drug up disproportionately fast because of tightness in the labor market. That was a pretty nice thing. Unfortunately, that ended with the recession. And in fact, what happened was the recession hit the low income workers disproportionately hard. And when you see that spike down in April of 2020, we saw huge numbers of job losses, but actually the average wage of working Americans rose very substantially. And it rose very substantially because all the low income people left. They were thrown out, they lost their jobs. This is going to set back progress towards greater wage equality quite a bit. And kind of moving forward, we need to be very aware of this. And on the flip side, you know, it distorts the macro statistics that as the recovery occurs, more and more low-income people are going to be brought back to work, which will suppress the aggregate wage growth numbers, which kind of is misleading. But the fact is that in terms of who took the hit, it was overwhelmingly the kind of minimal wage workers that had been seeing some pretty nice advances later in the last decade. That kind of ended with the COVID. So with that, I'll turn it back to you, Paul. It's always good to end on a gloomy note. So.
Well, that was a very good overview and also an excellent transition, because this program is all about health and economics, and we're going to kind of go back and forth how one impacts the other. And I'm going to pass it to my colleague Barbara, related to what did the COVID economic crisis do to how it disproportionately impacted the underserved, as Tom did a nice job of kind of building up. So Barbara, I'm going to let you take it from here. You have 3 slides, and we're very excited about your perspective.
Thank you, Paul, and thank you, Tom, for helping me with understanding economics. It's never been my strong suit, but I know since COVID, we have all been interested in knowing the impact of COVID, not only on our economics, but on all social determinants of health. And when we think of social determinants, we look beyond just health and healthcare, but we're certainly looking at the impact on education, the impact on jobs, the impact on living conditions, how people secure food, and everything. Dr. Stephen Goldstein, Vice Chancellor of Health Affairs at the University of California, indicated that COVID will find its place in the history books and loom large in our memories. It will also offer us lessons on how to prevent future crises. And these lessons include the provision of basic health care for all and addressing inequalities, manifesting now as strikingly disproportionate deaths among the underserved. And we know that has been so very true, because COVID-19 has shined a huge spotlight on some very systemic health disparities, social inequities, and things that have existed and deeply rooted for a very, very long time. And why has this happened? Because there's always been a higher incidence of pre-existing conditions such as hypertension, diabetes, heart disease among Black and Hispanic American individuals. So the United States Census Bureau, in collaboration with a series of multiple health and human service organizations, both at the federal as well as the state level, they work in collaboration and have been securing information throughout COVID-19. And this information is really very qualitative in nature. When they're asking individuals and families, what has the impact of COVID-19 been on your household? And I found this very striking, that as we look at that, this survey itself, the US Census Bureau Household Pulse Survey, is then disseminated very quickly back to the states, back to the federal government on how to act. The nature of this information is for taking action and really understanding what people are going through. So this has been done very frequently, but it was interesting to see that those who were experienced the greatest level of shock, of course, were Hispanic populations, African-American populations, as I mentioned earlier, because they have a higher incidence of health disease as well as issues relative to social determinants of health. Non-Hispanic whites, 52%, other Asian, American Indian, and so on, 51%. So as we can see, there's been a great shock on the household of individuals. And coupled with that, another survey that was done by CDC, looking at the mortality and morbidity. And this was a recent survey that was posted in October, just a month or so ago. And it also showed that when they look back over history, the CDC, and looking at other flu and other major disasters that have occurred, that even with looking at what has happened in the past, a lot of people have been saying, you know, this is no different than the other flus we've had, the swine flu and the, you know, but it has been very different and has had a greater impact. And looking at that study, it also showed that among the over almost 220,000 deaths, that the greatest population that was impacted were Hispanic Americans. Once again, it's indicated that 53.6% in disproportionate increases. And among African American populations, Asian populations, it was a little less. It was 29 to 36%. Among among white populations, 11.9%, a much lower increase, but yet we still saw increases across every race in regard to comparing this flu to other flus. And so we might ask, why is that? One of the reasons that was attributed to that is that in some of our populations where we have very urban populations, particularly where people live very close together, where there's such a high reliance on public transportation, such as buses and so on, train, subway, that there is a much higher incidence because of even their environmental conditions. Again, another social determinant. And also the impact of being able to secure food and things of that nature. So that's one area that was really has been a significant impact. So when we look at the impact on their physical well-being and their experience in terms of COVID-19 and how it's had a great impact on them, we also see it's had a major impact on household income. Once again, this really looks a lot like some of the surveys that we saw as we've been watching the polls in terms of the experience with individuals on their income. And so those, of course, that are less, less income, such as less than 25,000, we see much higher percentages, of course, 73%, 72% with 25 to 34, and so on and so forth. And those, of course, with higher incomes, such as 200,000 and above, they did not have such a significant experience. It was all interesting to see that in 26 states, 1 of 5 households was behind in rent back in July 2020. And the number of people not in the labor force, but who wanted jobs were spiked during that period in April by 4.5 million and has remained elevated. And coupled with some of the information that Tom had shared, there was a major loss of jobs. When we talk about the number of jobs that were lost, there was a little bit of improvement, I guess, back in May and June, when a lot of jobs were made available. But then since then, it looks like there's about at least almost 11 million jobs that have been lost. So a lot of job loss related to this. And according to just a little tidbit of information, the Kaiser Foundation, Family Foundation, was writing about the disparities and indicated that the disparities in health relative to COVID-19 will be approximately 93 billion in excess medical care costs. I found that, just alarming. We know how high healthcare costs are prior to COVID. So when we look back, I think it's going to take a while to really even track. This number might be even, much less approximated than what it's going to be, but that is significant. And indicating that $42 billion a year in lost productivity and premature deaths. And so I think it's so important that as healthcare and biomedical industries, we really must think about how do we engage more fully in creating sustainable, effective, equitable partnerships with our communities, with our health and human service, government, education, all of our organizations, so that we can form partnerships in addressing this information and being able to really help people through this, because it's really going to take a lot. And we're not just trying to survive. We want to really bring our economy back to where we can thrive. And so I think we're going to have to take some very, very serious steps to be able to address the impact of COVID-19 and the impact that it's had not only on households, but on particular populations, and how we can assist people so that they can thrive and get back to normalcy. We talk about the new normal, and I don't think any of us know what that's going to be, but we do know that this creates a lot of opportunity for prevention, for being proactive, and how do we really address the needs of populations. I want to also share another quote that was shared with me in terms of David Flood, who is a senior vice president from Salt Lake City's based Intermountain Healthcare. Those of us in healthcare, we pay a lot of attention to Intermountain Healthcare because they're always upfront, they're always very innovative. And he made the comment indicating that the current financial challenges that healthcare is seeing that have been brought on by the pandemic, coupled with a foreseeable future economic uncertainty, has raised the urgency of fundraising operations to alleviate the fiscal strain and indicates that we're right now, healthcare is seen as being in the eye of the storm. So this is very, very interesting information. And as we pull together a lot of labor statistics, a lot of economic statistics, as well as healthcare statistics, it really brings us to where we are, and it helps us begin to foresee some of the steps we need to take to bring our world, our nation, our families, and all back into some level of normalcy.
Great. Thank you very much, Barbara. Great points. And that's a good segue to Kirsten Axelson. And Kirsten really is working right now on some analysis related to the vaccine. And her background is actually in biomedical science and industry. So she's our industry representative. And instead of just looking backwards, what Kirsten's going to help us understand is looking forward. What happens in the process now to get the vaccine out to people, and what is the priorities for that? Because without the vaccine being part of the picture, we won't get to economic recovery as quickly, if not forever. So Kirsten, I'm going to pass it to you, and you just tell me when to advance your slides. Welcome.
Thank you so much. So I'm Kirsten Axelson, and I'm a senior policy advisor to Charles River Associates. And the Center for Global Health Innovation invited me and my colleague, Regina Jayasuriya, to co-develop a framework that would address both ethical and economic considerations for allocating a vaccine in a period of scarcity. As we know, biopharmaceutical companies, federal and state governments, pharmacies, pharmaceutical distributors are racing to develop and set up a system for distributing one or more, hopefully, vaccines for COVID-19. So our white paper and framework will consider how would you allocate this vaccine to maximally limit harm from the pandemic and maximally restart the economy. In summary, of course, in any allocation framework, whether ethical or economic, the people most at risk of experiencing harm from the pandemic should be prioritized. As Barbara and Tom have already mentioned, a high number of people who experienced mortality from COVID-19 had multiple chronic conditions, were in lower income, many were over 65. And of course, with the over-indexing on multiple chronic conditions, that meant that the disease affected African Americans, Hispanics, and Native Americans to a much larger degree. The other thing that will be important, even once there is a vaccine, is a sustained emphasis on public health measures such as PPE and social distancing. All vaccines are not 100% effective, and we will not have enough vaccine, very likely, or cold storage to allow every possible individual to be vaccinated. So we will have a long period of sustained public health measures beyond the vaccine. In any framework, typically essential jobs are prioritized: health workers, people who protect national security. But we have seen in this pandemic that certain essential jobs have higher risk of contacting COVID-19 than others. Home health aides, nurses had a higher, people who are more proximate and touch more people have had a higher risk, where other health systems have been able to contain the spread of the virus to what is very similar to the general population through PPE and other protective measures. And then even as we look through the non-essential jobs, there are certain jobs that have higher value to the economy than others, such as those jobs that allow others to return to work, like caregivers, and then also considering the jobs multiplier. And there we want to consider both the formal and informal sectors of the economy. And then as much effort has been put into the science of getting the vaccine out into the community, we need to be putting into information, both the sharing of information from trusted messengers and efforts to collect information about the vaccine in the real world setting to really reinforce the safety and efficacy of the vaccine once it is being used in the community and in practice. So we want to go to the next slide. So this in a slide format is essentially a summary of the work and risk allocation framework that we propose. So starting from the higher risk individuals on the left side, And the top priority is going to be higher risk people with multiple chronic conditions. As we kind of move down the prioritization, higher risk people who have a single risk factor. Within that group, you want to look at those who cannot social distance. Many people over the age of 65 are still working, either formally or informally. And to look at the ones who cannot effectively and productively do their role with PPE and or social distancing. And of course, within that group, single risk factor or multiple risk factor, there are people who cannot remain separate from others because they're in a community environment, such as an assisted living facility where they are brought into proximity with others. Then moving over into the population that is the working population, which we typically think of the population that we need to restart the economy. There are a number of jobs, and shortly we're going to take a look at how much those jobs contribute to the economy that can be done safely with social distancing and PPE. And then there are other types of roles that require proximity to others or allow other people to go back to work. Furthermore, we have to consider about the ability to contain a work environment. If we are vaccinating part of a sector, but is bringing together both vaccinated and non-vaccinated individuals, that can reduce the benefit of prioritizing that sector. So if we want to keep going. So here are the industries that contribute about 90% of GDP. If you look at the top two, financial services and professional and business services, that's about a third. Many, I'm sure not all, of those jobs can be done relatively productively with social distancing and PPE. This is a big part of why the highest income part of the population has experienced very little income shock, and employment levels are largely back to where they were pre-COVID in the top quartile of the economy. Then if you look at, keep kind of progressing down at other roles within the economy, manufacturing is roughly 11% of US GDP as a value contributor and creates a huge number of other jobs. If you go off to the column on the right, that's basically saying for every 100 jobs in durable manufacturing, there are 744 other jobs directly or indirectly created. So it's a sector where you could say high job creator, high output to the economy, and largely one that you could contain. You could, through vaccination and sort of protocols to use PPE when you're outside of your work sector. Again, no vaccine is going to be 100% effective, but that is a sector that could be sort of more safely and reliably contained than others. As we sort of move down into other sectors, you want to consider things like leisure and hospitality. Important, certainly there are people in those sectors who have had a tremendous job loss, but until there are sufficient vaccines, you would want to be cautious in your use of vaccines and reopening sectors of the economy where you might be bringing vaccinated and unvaccinated individuals together and potentially doing more harm than good. We want to get to a place, obviously, where every person has vaccine available and we can achieve herd immunity. And we will get there, but it is likely to take some time, again, both because of production and cold storage issues. If we continue on. And then, of course, we want to be considering what it will take to get people to use the vaccine. It's not just availability. As many of us have mentioned, the impact on health in non-white communities has been much higher. Far more people were hospitalized for COVID-19 who were African American, Hispanic, or Native American relative to whites. When we look at other vaccines, and here's a comparison between influenza, pneumococcal disease, and tetanus, there's been a significant gap of 10 or more percentage points in the use of vaccines between whites, African Americans, and Hispanics and Asians. The amount of work we're putting into developing vaccine needs to be also put into identifying trusted messengers and routes to encourage the use of vaccines in the populations who need them most when they're developed. And then finally, as we think about what we need to be investing in now, in addition to creating a vaccine and distributing it, it's understanding and prioritizing how to get to the individuals who are going to be who have been most harmed, and also continuing financial and social support. As we said, not everyone's going to be able to go out and go to work and re-enter the economy when there's a vaccine. Evaluating and studying within types of work who is most harmed. Again, I think particularly in the healthcare space, where we have seen that certain types of workers are more at risk than others. And then building and collecting systems to get information about the vaccine when it is in use, so that we have real world evidence that can continue to expand our knowledge about the vaccine, especially in certain subpopulations who may or may not have been as highly represented in the clinical trial. So with that, I will turn it back to Paul.
Okay, thank you, Kirsten. One thing that I want to kind of summarize from our conversation today and the time that we have, and then open it up for questions, is this economic transformation in the future based on health. And I see all these people in this picture you're seeing in front of you, and none of them have masks on, and none of them are 6 feet apart. And that indicates to me that this is an old graphic. But to get back to that place where we were vibrant and connected and growing, not just as an economy, but in our health status, is very, very important. And I think that Georgia Bio provides an ideal framework and springboard for that kind of transformational initiative in the future. And the reason being is that all those sectors that Kirsten showed are very siloed. And one nice thing about this organization that you're all a member of is you can work across industry, academics, economic development, healthcare, and it's a very nice kind of a vertical platform for connecting. The other thing I want you to think about is the fact that healthcare organizations make up only about 20% of the health of people. And we have big, strong hospital associations and physician groups that are kind of at the top of the pecking order in the association world, but actually they have a very small impact on health. And that's one of the things we need to think about, is that US health systems are starting to invest in social determinants, but think about that other 80% that has to be worked on and connected with. And this is some of the work that Barbara and I have been engaged with for 30 years now. And that is to get health to be the focus, not healthcare, and shifting that strategy. And then the thing that's probably the most important thing for all of us on this program to think about is, how can we do community transformation? One, I think, issue that I ran into right away in my career is I was really good at measuring things. I'm an economic geographer, so we spend our whole life measuring things. And if I'm in Kansas City here, where I'm presenting today, and I walk 2 miles to the east on this one street, 55th Street, the life expectancy goes down by about 15 to 20 years. So it's 85 in my neighborhood, and it gets to be like 65 2 miles from here. And I think a lot of us are starting to say it's not enough just to know that, because as the racial and economic, every step I take, it gets lower and lower and lower. The reality is, have we done anything about it? And it's almost become a moral question. And that is knowing about something and not doing something, is that okay anymore? And I don't think it is. And I think in the next 20 years or so, we're going to look at a lot of these issues here leading toward an area of focus around community transformation. And the last thing I want to kind of say is that by having groups of people, even in our panel, we're all different people and we all come at this from a different perspective. But I think we can all agree that there are many areas of focus that we can all get behind in health, education, quality of life, economic development. And we can't no longer, in this COVID era and post-COVID era, stay back in our comfort zones. I can't sit there and say, I'm really good at telling you that there's disparities, but I don't do anything about it. And the pharmaceutical industry and the bioscience industry and the economic development industry can't keep pointing fingers at every other industry. We need to all come together and say, what can we do together to make us a healthier country, and by doing, or state, and by doing that, can we be a more economically viable and prosperous country? So I want to use this last few minutes to see if there's any questions about communicating the economic impact of COVID. I think we did a fine job today. I want to thank my friends and fellow panelists of kind of getting the information out there on this. But what about what's next? What are the community transformations that we see across Georgia? We've all learned a lot about Georgia in the last 2 days. We've learned from the national media that it's changed demographically. We've learned that it will probably determine the presidency and maybe the control of the Senate. We've learned that there's a lot of demographic changes that have been going on. But the question is, how do we move forward? So I'm going to leave that. And if I don't see questions come in, I want to just ask each person for a quick soundbite. What was your number one lesson that you experienced through COVID? And I'll start. I learned that after a forest fire, the soil gets better in nature. And I think we can grow back stronger because I learned a lot about how I can make what I do more effective. Barbara, what's your takeaway from COVID?
I guess one of my takeaways is really the fact that COVID denied me some opportunities. I guess in terms of being out and about, being who I am, one of my first impacts and most disappointing, I guess, is not being able to be out among my family and church family. Yeah. And one of the things I learned about all of this is that I never want to repeat this year again in terms of the separation and the togetherness and things of that nature that mean a lot to me as an individual, how it has made me feel. And, it's one thing to be, learning at home and doing school at home, but when you can't be around people and when you are around people, you have a certain level of fear, So one thing is that I learned that I don't want this to be repeated. I don't like the fear factor that is created because I recognize that COVID has impacted my race, particularly almost 3 times more than any other race. And when I think about that, it makes you a little cautious.
Yeah, and we mentioned
that hospital administrator and a nurse. So I've learned that I want to do something, that we could do something about this, that nobody else experienced what they've experienced this year in terms of the negative. But then there's also been a lot of positives in terms of how we learn, such as Zoom, and we're doing so much in other ways. It's a very positive because we've learned we can do things, we can learn in other ways, we can be together in other ways. My family celebrated Mother's Day by Zoom, so that was a good takeaway.
Well, and we said before that Barbara's got 55 years plus experience, which would make her a little older than just 55. So you had a lot of things. I'm going to move to Kirsten real quick. Your takeaway from this year personally.
Well, my takeaway is whatever value we thought there was in treating non-communicable diseases, in particular cardiovascular metabolic disease, we dramatically underestimated that. And we've underestimated it for this pandemic. We've underestimated it for the outcomes that we consider cancer, HIV. Any risk to our population is so much more compounded, and we need to be not considering the value of treating disease on average, but we need to be considering the value of treating disease, especially for the populations who are most at risk.
Mm-hmm. Great. And Tom, the economic designer, what's your takeaway?
I'm kind of disturbed, I guess, by the willingness of large segments of the population to believe stuff that just isn't true. Yeah. I don't quite know what to do about that. That just by nature, I'm kind of an academic and think that, there are limits on what we know and what we don't know. But that's a very different thing than just kind of making stuff up. And the willingness of people to kind of fly in the face of evidence in particular is troubling to me. And I think that speaks to a lot of our educational institutions and kind of what we've actually been teaching. And kind of the socialization process around science and the physical sciences in particular.
Yeah, I want to also kind of close our session by challenging really everybody to take the energy that came from this year. Some of it was anger, some of it was fear, some of it was just I don't even know what the word is. The social isolation for me was difficult because I spent 250 days a year traveling for 35 years. That's 8,000 days on the road. And I became an inside cat. And I had to learn since 1985, I've been on the road almost every other day of my life. And I had to learn where my litter box and food bowls were. And it was difficult for me to be disconnected. And so we have to take whatever that was and put it toward good in the future. And all of us, I think, benefit from collaboration and connection. And so I wanted to thank the folks from the conference for inviting such a interesting group. I don't think any of us would consider, well, maybe Kirsten would, but I don't think any of us thinks of ourselves as bioscience people. Kirsten is, but the rest of us are just people that have come into this collaborative, wanting to bring our talents and skills to make Georgia a better place, but also the world a better place. So Megan, I don't know if you're on, but we're going to pass it back
Yes.
to you.
Oh, you don't have to do that. You were the one that can close up the session.
Well,
But we did have one question in the chat, which I think you kind of addressed. It was, how do you overcome the understandable distrust of communities of color over healthcare vaccination and experiments such as what happened at Tuskegee?
Yeah, I think we covered that, and so much of it's intimate collaboration and connection with those communities and with persons of color. It can't be at a high level. It's got to be at a much more real grassroots. There has to be trusted people, and
Yeah, great. Well, thank you guys so much for being here today. Like you said, you don't feel like you're in the life science industry, but we greatly appreciate your input, and this was great. So
okay,
thank
good.
you.
Thank you, everybody.
Thank you.
Everybody
Best
have
of
a
luck.
great day.
Thank you all.
Thank you, teammates.
Okay, thanks.
Bye-bye.